Hello, everyone. I hope you had a lovely lunch. I'm very excited to be here. I want to echo Sungwoo's thank yous from this morning for having us, especially Seoul National University Hospital. Thrilled to be here and honored and talk to you guys today about assessing and treating problem behavior in the adult service population. So I'm going to first start with an overview for how all of my talks are going to go today and tomorrow. I have 4 total. So to go through all of them, we're going to go through a hypothetical patient named Bruce. So I'm going to talk about him a little bit, how we track progress throughout an admission, what a treatment plan looks like at discharge, and then how we got to that treatment plan is going to be what the entire 4 talks talk about. And the handouts that you'll need for this one is the treatment. So those are the stapled handouts that were in the front of the book. So Bruce Banner's treatment is going to be relevant for this. And before I start, I wanted to say thank you to my team at the Intensive Outpatient Clinic at Rutgers, especially Nicholas Migliacchio and Victoria Flanagan, who were our actors in the videos. So Nicholas is one of my BCBAs, and he's playing the role of Bruce. And Tori is one of my lead behavior technicians, and she's going to act as the caregiver. And Yurden is going to pass out some materials for our role play practice, and Tori also helped to make all of those. And then I'm going to show you guys a lot of graphs today and a lot of data. And one of my lead behavior technicians, Kiet Tran, also helped out. So thank you to my team. So Bruce Banner. So this is a hypothetical patient. If you guys know the Avengers from Marvel, Bruce Banner's the Hulk, so we use that name a lot in some of our practice materials. So Bruce Banner, we'll say, is a 27-year-old male with diagnoses of autism spectrum disorder and some mild intellectual disability. So the behaviors, we'll say that Bruce was referred to my clinic to assess and treat self-injurious behavior, aggressive behavior, and disruptive behavior, which we also call property destruction. That's what Sungwoo called it this morning. So you guys have the, the operational definition handout also in your packets from this morning. So before we start treatment with any of our patients, Sungwoo talked about operational definitions this morning too. And so one of the first things that we do is we operationalize why they're coming to our clinic. What are the problem behaviors? So we make very specific definitions. So for example, self-injurious behavior is defined as attempting to or successfully biting, scratching, slapping, hitting, pinching, or punching himself in the head. We want to make it as specific as possible so that we know what counts and what doesn't. And so that's why there's a distance criteria, 15 centimeters, because if he's just going like this or scratching his head, that doesn't count. We won't take data on that. And I'll give you an example of what some of these look like. So this would be the hand-to-head. So you see it's from a big distance. This would not count. And then we have self-biting. Next, we have aggressive behavior. So this is attempting to or successfully hitting, punching, pinching, grabbing, slapping, or scratching others, or throwing items at somebody. There's also a distance criteria in there too, because if I take this water bottle and I throw it at Sungwoo, that would count as an aggression, but if I just throw it over here, that would fall under disruptive behavior. So that's why it's very important to be as specific as possible so you know what to take data on. So an example of aggressive behavior here is hitting others, and an example of grabbing others. So we make these definitions for all problematic behaviors. The top 3 problem behaviors you see, we call those combined target behaviors because those are the target for the admission. Those are the main reasons why they were admitted to our clinic, the most problematic. And those are the problem behaviors that we want to decrease by at least 80%. There might be other behaviors that they engage in that are slightly problematic, but they don't necessarily need to have an intensive outpatient clinic admission for that. So for example, dropping to the floor is not appropriate. It is problematic, but it's not why they were referred to our clinic. So we can keep track of it too. We take data on it. We have it defined, but it's not what we consider a target behavior. So how we track progress throughout the admission, so both today and tomorrow I'm going to talk to you guys about running individual sessions that could be like 5 to 10 minutes long, and we take data during those too. But throughout the day, outside of those sessions, we also keep track of how many problem behaviors they're engaging in. And our patients are with us for 6 hours a day, 5 days a week. So they're with us for a very long time. So we have, this is an example of a data sheet that's separated into half-hour intervals. And for the definitions on the bottom, we keep track of how many times they engage in that problem behavior, so frequency count. A lot of times we have them color-coded on the bottom because we also have the clickers, the counters to count problem behaviors, so they just keep it on there. They have them color-coded, so if they engage in self-injury, they click on the red one, just makes it a little bit easier. And the definitions are always present on the data sheet too, just in case there's any questions on what counts and what doesn't. And let's just say, for example, this is an interval, so from the 1:30 to 2 o'clock interval, we saw 1 instance of aggression. From 2 to 2:30, we saw 1 instance of self-injury. And then in the last interval, we saw 2 instances of disruption. So we take all the data so that we can graph it and analyze it and know if our treatment worked or not. So this is an example of a baseline condition. So when the patient is first admitted to our clinic, we don't have a treatment for them yet. That's why they're there, so we can assess the problem behavior, figure out why it's happening, and then come up with a relevant treatment. So in baseline, we'll say Bruce Banner did not have a treatment in place right now, but we're just keeping track of how many times he engages in these problem behaviors. And so this is converted into responses per hour. On the vertical axis, and you can see he's engaging in a fair amount of problem behaviors, self-injurious behavior, aggression, and disruption. So after we complete our baseline phase, that means we've finished all of our assessments, we've finished our treatment evaluations, those individual treatment evaluations that I'm going to cover today and tomorrow, and they're ready to have a full day treatment. So they have a behavior support plan that we call in the United States, which is just a lot of times schools call them behavior intervention plans, and it just means these are the prescribed procedures to implement all day long with them. So after baseline, like I said, our goal is to always have at least an 80% reduction in problem behavior. So we put that on the graph. That's the red line you see there. So that's our goal, is to have every day be at that line or below. And so let's say in his treatment, we ran all of his treatment evaluations. We put it into an all-day treatment package. And it seems very effective for Bruce Banner. So this would be a very good outcome for one of our patients. So Bruce Banner's treatment package is also one of your handouts. And so he has 5 different components that we have prescribed for his treatment. And how we got here is what I'm going to cover both today and tomorrow. So the training overview, first we're going to go over functional assessments, specifically the functional analysis, the experimental functional analysis. And that will tell us why do we need to do any of these components at all. Because as Sung-Woo mentioned, we need to know why they're engaging in the problem behavior so that we can treat it appropriately. And so the functional assessment is a crucial first step. And also why component 1, and I'll talk a little bit about the difference between planned ignoring and extinction tomorrow. Part 2 today, so after we go over functional assessment, we're going to talk about preference and reinforcer assessments. So how do we know what Bruce likes and what he'll work for? In component 5, you'll notice that we're using the iPad as a reinforcer. How did we pick the iPad, and why did we pick the iPad? Then tomorrow, we're going to cover treatments based on differential reinforcement. So how do we know that components 2, 4, and 5 are effective? We're going to answer that question tomorrow. And lastly, tomorrow, we're also going to answer why did we choose component 3, and how do we know that that's effective? So then without further ado, I'm going to get into part 1, functional assessment. So we're going to talk about functional behavioral assessment broadly, just for a little bit, because Sung-Woo spent a lot of time giving us some great information this morning, and so I don't need to repeat him. Then we'll talk about the traditional functional analysis, and then the traditional functional analysis, as Sung-Woo mentioned, looks to see if individuals are engaging in problem behavior for really common reasons, like access to attention, escape from demands, access to tangible items. But there are many more reasons why somebody can engage in problem behavior. And so the last part of my part 1 is talking about how do we identify those, what we call idiosyncratic functions, those really specific functions. And so you guys also have the session description for the functional analysis. So hopefully you guys aren't falling asleep because you had a really big lunch. If you are, we are going to move and we're going to practice the functional analysis today. So once I go through the methods for the traditional functional analysis, we'll kind of take a break so you guys can practice with each other. And I'll answer any questions that you have. So the purpose of a functional behavioral assessment is to identify the maintaining factors of the problem behavior, meaning why do they engage in the problem behavior? What are they getting out of it? So there's many different ways that you can do it, but they're categorized into indirect assessments and direct assessments. Indirect assessments mostly means that you're not really observing the problem behavior. You're getting your information elsewhere. And Sungwoo mentioned these this morning too. So we have standardized questionnaires like the questions about behavioral functioning, QABF. There's a couple of them. The FAST is another one. And you can also customize your own. Have open-ended interviews with caregivers. For direct assessments, you can have observations. ABC data collection is very common. Sungwoo already mentioned the ABCs, antecedent, behavior, consequence. And you could also have unstructured observations where you're just able to observe them more anecdotally. And then we have the best way, the gold standard way to identify functions, and this is through the experimental analysis. And so in any experiment, you have a test condition, you have a control condition, you're able to make cause and effect relationships and determine this is why they engage in problem behavior. All of the other methods give you correlational information at best, and as Sungwoo mentioned, there's a lot of research out there that shows that there are inconsistencies with those methods. Nonetheless, ABC data collection continues to be a very popular method, and sometimes ABC data collection, we use this too to inform our functional analysis because it gives you a lot of good information, observational information, so that you can design your functional analysis more appropriately. So to take ABC data collection, there are two ways that you can take ABC data. One is through what this is. This is narrative ABC data collection, where it's just open-ended and you can write in what happened before in the antecedent column, what specifically the behavior was in the behavior column, and then what happened after in the consequence column. And so we are going to hopefully watch a video example. This video was not working when we tested it earlier, so we'll see if it works. So we're going to watch a video. So this is for a hypothetical patient, Mona Lisa. This is from a TV show called Parks and Recreation. That was around like 2015, if you're familiar with it. So the instructions are, if Mona Lisa engages in any kind of dangerous behavior, detail what the behavior looked like in the behavior column, what led up to the behavior in the antecedent column, and then what happened after in the consequence column. So hopefully the video works, then we can watch it. If not, I'll tell you what happens.
Daddy, someone set a fire in your car because you took too long and I got bored. Money, please.
Oh, no, there's no money.
Oh, my bad. No problem.
Oh, okay.
That's fine. I'll just destroy this office.
Oh, hey!
Money, please! Money, please.
Ben, give her some money. It's easier.
So in this example, the antecedent was that Mona Lisa was denied access to money. She asked for money, and he said, no, there's no money. And then the behavior we saw, she threw an object on the ground. She engaged in property destruction. And the consequence, she asked for money again, and her dad said, just give her the money. And so this is very helpful information. We can't make any cause and effect relationship because it's observational, but now we know that, okay, maybe we want to do a functional analysis to test, does Mona Lisa engage in property destruction to gain access to money? We can then form and design a functional analysis based on these observational data. And this is an example of what a data sheet would look like for the other kind of ABC data. So the one we just saw, again, was called narrative, or you can call it unstructured, and this one you can call structured, or some people call it coded ABC data collection. So you have pre-selected options here. So for the video that we just watched, for the A in the antecedent section, we would check that an access to an item or activity was denied. We would check that she engaged in property destruction. And we would check in the consequence column that access was provided to the desired item or activity. And so there are pros and cons to both forms of ABC data collection. If you're able to train people in how to do this structured form of ABC data collection, it can be quicker. Training is very important though, especially if the BCBA is not the one collecting the data. If it's more direct care staff who don't have the training, you as the BCBA would have to do it. So sometimes we ask parents or caregivers to collect these data, and you need to make sure that they know how to do it. And if you have somebody who's not trained in behavior analysis like a BCBA, you might get better information from here because they don't know what to look out for with like the eyes of a behavior analyst. So a lot of times if somebody engages in problem behavior for attention, the antecedent a lot of times is low attention. Like maybe mom was sitting there reading her book and then all of a sudden the child has problem behavior. And so if it's the narrative one, she might check NA or not applicable, nothing happened. When that's not true, us as behavior analysts, we know low attention, that might set him off. And so this might be better for people who are less trained, but either way, you do have to do some sort of training with whoever's collecting these data. And as I mentioned, there are inconsistencies found between these methods and the experimental methods. And so the experimental methods are the best ones to do. However, for safety reasons, when you're doing an experimental analysis of functional analysis, you are kind of triggering the problem behavior. A lot of times we explain the functional analysis to caregivers as an allergy test. So when you get an allergy test, you're exposed to a bunch of allergens and you see which one pops up. And so this is the same. You put their child in a bunch of different settings. Maybe you're giving them demands, you're doing work. Maybe you're putting them in low attention. Maybe you're saying you can't have your iPad right now, and you're seeing when they have problem behavior. And then based on the consequences. So if you're not properly trained in how to do a functional analysis, I would not recommend doing it just for safety reasons, for the child's safety or the adult, whoever you're working with. But if you do have the training, this is the best way to go, and that's what we usually use in our clinic. So I'm going to start with going over the standard functional analysis. So this is the handout that you guys have. This is a session description. So before we run any assessments or treatment evaluations in our clinic, we have a session description written so that the team members know what to implement. Because in our clinic, the BCBA is not usually the one implementing these sessions, the lead behavior technician. So each patient in our clinic has 3 behavior technicians supervised by a BCBA. And so myself and the BCBA create the session description with the team leader of the 3 technicians, and then everybody else has to read it and make sure they know how to implement everything before we then run the session. So a very important document to have to make sure that everybody's on the same page. So these are the standard conditions inspired by the articles that Sungwoo mentioned this morning, especially the article by Iwata and colleagues in the late 80s, early 90s towards a functional analysis of self-injury. And then a lot of methodologies have been improved since then as well. So this is a pretty standard session description for a functional analysis. So we have several conditions. We have the alone or ignore condition. We have the attention condition. We have the toy play condition, the demand condition, and the tangible condition. And so I'll break them down one by one, starting with the alone or ignore. So this is from the session description that you guys have in front of you. So in general, so there's 2 different options here. You can do an alone condition or you can do an ignore condition. The alone condition is preferable because in this condition, you're trying to test if the individual engages in problem behavior for what we call automatic reinforcement. You guys heard about that a little bit this morning with Sungwoo. So problem behavior can happen, it's broken down into, you can break it down into 2 larger categories, social reinforcement and automatic reinforcement. Social reinforcement is anything in the environment. Something in the environment is reinforcing the problem behavior, whether that's positive reinforcement or negative reinforcement. Automatic means the behavior itself is reinforcing. The individual is getting some sort of sensory reinforcement out of engaging in the problem behavior. So sometimes automatic reinforcement is also called sensory reinforcement. So if you think of somebody who maybe has like a rash and they're engaging in a lot of itching and it's breaking the skin, It's not my attention. It's nothing that I'm doing that's leading them to engage in that behavior. It's the behavior itself. It's the relief from the itchiness is why they're engaging in the problem behavior. So a lot of times self-injurious behavior is automatically maintained. And this condition tests for that. And the reason why the alone is preferable to the ignore condition is because in the ignore condition, you have somebody else in the room with them to block dangerous instances of self-injury. Now, that's great because we can keep the patient safe, but what's not great is now you have a confound of physical attention. So if you have somebody in the room to block, you're providing physical attention. And so if they engage in problem behavior to access physical attention, you're not able to separate out the automatic function. So you could do either. Top priority is always keeping the patient safe. So if they do engage in really dangerous self-injury, running an ignore condition is considered appropriate just to block those instances from happening. If it's not very dangerous self-injury, the alone condition is preferable. So in the alone condition, the therapist is outside of the room. Nobody's in there. The materials, we usually have 2 chairs and maybe a table in the room. We try to take everything else out of the room as much as we can, just to eliminate any other confounds that might be in the room. And before we leave the room or start this condition, we tell the patient, you need to stay here for a little bit. I'm going to be back in 5 minutes, or however long the session is. If it's 10 minutes, you would say 10 minutes. The videos that I'm going to show you are 3 minutes long. So Bruce, you need to stay here for a minute. I'll be back in 3 minutes. So if you're doing the alone condition, the patient then is just in the room alone with no toys or no therapist or nobody. Sometimes the patient might try to get out of the room. If this happens, then we just tell our technicians to let your BCBA know as soon as possible if that happens, because you might have to modify how you're doing this, because we don't want to, a lot of times the functional analysis comes really early on in the admission, and we don't want them to not want to come back, have a horrible experience, or have a negative relationship with the therapists. So if that happens, then we definitely want to note that and change our methodology accordingly. Many times the patient just hangs out in the room and they're totally fine. And when they're in the room alone, I also want to mention that we have observation windows. We toured a couple of hospitals yesterday, Sungwoo and I saw a lot of you guys have that set up here, which is really awesome. So there's a one-way window so we can see in, but when they look, there's a reflection. We also have cameras in the room. So while they're alone in the room during this condition, we are very much watching them. And so here's a video example of the ignore condition.
All right, Bruce, we're going to stay in here for a little bit, but we can't hang out right now.
So she's only in the room to block self-injury. She's not providing any attention or anything else, and she's trying to be a silent robot, ghost in the room as much as she can. Can be very boring. So we are seeing some instances of self-injury specifically here. We're not seeing the other combined target behaviors in this session, just self-injury. So Bruce might engage in problem behavior for automatic, self-injury specifically for automatic reinforcement. And so when I'm done going through all these sessions, I'll show you guys the graph of his results. And I did mention that each patient has a team of 3 people. The 2 other people, so this is 1 person, 2 people are probably taking data during this. And so every instance, we have a software to take data on computers. So we usually have data collectors on the other side of the one-way window taking data on these problem behaviors. So the next condition we're going to talk about is the attention condition. So the one that we just talked about, the alone or ignore, is the only condition that tests for automatic reinforcement. All of the other test conditions are testing for different kinds of social reinforcement, something in the environment. And so one of those is, do they engage in problem behavior for attention? And this helps to answer that question. So the materials for this is usually some sort of a reading material because we pretend to be busy. So in all of these social test conditions, you start out, so the stimulus condition, how you start out is, in theory, if they engage in problem behavior for attention, the setting condition should be what's aversive to them, which is low attention. They don't like low attention. The hypothesis in this is they engage in aggression, so they engage in problem behavior to access the attention. So you have to start out with no attention. Attention happens contingent on the problem behavior. So we have our reading materials, so we're pretending to be busy. We have the two tables, we have chairs. We have some moderately preferred toys just to control for the event that they're engaging in problem behavior for either tangible reinforcement or just because they're bored. So we give them some moderately preferred activities. And what we tell them is, I need to do some work, or I need to do some reading, or I'm going to be busy, and not available for 5 minutes. So we're going to tell them, I'm busy, my attention's not available. So the stimulus condition, as I mentioned, the therapist is in the room reading a magazine or pretending to be busy. And if problem behavior happens, we are going to provide attention. We usually provide both physical and verbal attention. So if they engage in aggression, ouch, that hurt. Or if it's self-injury, oh, don't do that, you're really going to hurt yourself, while blocking the problem behavior. They could engage in problem behavior for different forms of attention, physical versus vocal attention, and you can separate that out if you want to, but usually we have them together, at least initially when we do our functional analysis. For any other behavior, like the dropping, we would just ignore that. And something else that we tell our team members to just keep in mind, are they appropriately asking to get attention? Are they saying, hey, will you play with me? Because if that happens, we obviously want to reinforce that. That's amazing. And so we would just modify our methodologies a little bit if that is happening. And here is a video example of the attention condition.
Hey Bruce, I'm gonna be busy for a little bit. I can't hang out right now. You're gonna hurt yourself.
So that's his moderately preferred activities, a sticker book. She has her magazine that she's reading. You'll notice that she is still watching him though, because she's supposed to be blocking self-injury if it happens. Because in our hypothetical patient, Bruce, his self-injury is very
Hurt your
dangerous.
arm.
So we're not seeing a lot of problem behavior here, right? Not a whole lot. So as of right now, I don't really think that Bruce engages in problem behavior for attention. but we're still going to test it out. And if we don't see problem behavior in this condition, in this traditional format, but the parents say like, I can never be on the phone, I can never just go and do the dishes, then we can tweak how we're doing things. We could maybe, instead of a reading material, I can tell Tori, the therapist's name, I can say, use your cell phone, or pretend to be on the phone with somebody. Or someone briefly mentioned this condition this morning, diverted attention. Maybe it's when two people are talking. So then I might have somebody go in the room and talk to Tori, and then if problem behavior happens, oh, that's so horrible, don't do that. We could also invite the caregivers to come in. We use actually something similar to this. So we'll be in the observation area, and the parents will have the headpiece, and we'll tell them what to do, we'll coach them through it. It's also not uncommon to see different patterns of responding with us versus caregivers, because we're very new people, they've never met us before. Sometimes there's what we call a honeymoon period, where we're new and fun people and they don't have any problem behavior with us. And so then we ask caregivers or regular service providers too, if we're working with a group home and they say that they have all this problem behavior with the staff, we might ask their staff to come to our center to evaluate that as well. The demand condition. So this is another test condition where we're seeing if they engage in problem behavior for a social reinforcer. In this case, it's escape from demands. It's negative reinforcement. So the setup for this, we need to have our demand materials. And so when we do the role play, Murin will hand out some of these so that you guys can practice. So for Bruce, we'll say that his instructions are writing his name, folding paper, stuffing envelopes, completing simple math problems, and identifying letters. And we just want to make sure we identify these work tasks before we start, and we put them in the session description so that we have the materials ready. These sessions are 5 minutes long. We don't want to waste a lot of our time with just trying to figure out what demands we're going to do. We want to know the materials that we need, the instructions that we're going to give, and be ready so that we can just give the instruction, write your name as quickly as possible. The instruction to the patient before you start is we're going to do some work for a while. And the stimulus condition, remember I said in a test condition, you're setting it up so it's the hypothetical aversive situation. So this is work for the individual. In the previous condition, the attention condition, it was low attention. Now it's work. So, hey, we're going to do some work for a while. Fold the envelope, fold the paper. The consequences for problem behavior, so if the individual engages in problem behavior, you're going to remove the demand. They don't have to do it anymore. So that's the negative reinforcement. So you're going to say, we're going to do some work for a little bit, write your name. They engage in aggression. You're going to remove the material. You're going to try to make it as clear as possible that they don't have to do it anymore. We try to not say anything because we don't want to confound this with attention. Because by saying, okay, you don't have to, that's a form of attention, and we're not testing for that here. We want to keep the variables as isolated as possible. So we try to not say that. We just remove it. Sometimes we'll even move the table. If it's a small table, easy to move, we just move the whole table away so it's clear that they don't have to do it anymore. Something that I also didn't mention here. If they engage in problem behavior during the escape, so the escape is 30 seconds long usually, so write your name, aggression, okay, we're not doing it anymore, and then let's say they engage in more problem behavior, at that point we ignore, because they're already in the escape. If that happens a lot, that's problematic, because in theory, for this condition, they're engaging in the problem behavior to escape the work. When there's no work, they shouldn't be engaging in problem behavior. Something else might be going on. It could be automatic reinforcement, too. If somebody engages in automatic reinforcement, it's not uncommon to see it throughout all of the conditions. So if you see problem behavior during the escape, it's something you have to look into a little bit more. And it's important to, when we collect our data, we separate out when data happens, when it's what we call motivation present, which means we've told them to do something, versus in the break, which is motivation absent. If you see problem behavior in the motivation absent, you might want to rethink how you're doing things because something else might be going on. Consequences for other behavior. So let's say they drop to the floor. We're going to ignore that. I'll probably, if that was the case, like for Bruce Banner, he drops to the floor, but it's time to do work, I'll probably bring it just right onto the floor for him. I'll be like, write your name, stuff the envelope on the floor, because it's not a target behavior. We're just going to ignore that it's happening and continue on with our procedures. Other non-problem behavior, if they ever do the work, if I say fold the envelope and they fold it, cool, great. We provide some praise for doing their work. And here is an example of a demand condition.
All right, Bruce, we're gonna do some work right now. Fold the towel.
So he engaged in disruption and aggression, and she's keeping track on her watch. Because we have teams of 3 people, usually our data collectors keep track of the time for the therapist, and when the time's up, they just give a on the window to signal to them that the 30 seconds is up and to give another demand.
Clean the table.
Doesn't have to do it. Notice Tori's not saying anything. She's just removing it and making it as clear as possible that we're in a break, essentially.
Broke the pens.
And so we're seeing a lot of problem behavior here, right? Both aggression and disruption. But what's important is we're not seeing it during the break, motivation absent. We're only seeing it when motivation is high, when she brings out the demand initially. So this one was sort the pens, immediate aggression. And so that was when the motivation was present, which suggests that he engages in problem behavior, both aggression and disruption, to escape demands.
Stuff the envelope.
Usually the problem behavior is a lot more severe. I told my actor to be more realistic, but he didn't want to hurt Tori.
Fold the towel.
And so see why it's important to have those demands already identified. They're right there on a side table for her, so she can be really quick with giving the demand. All the materials she needs are right there. Video's over. All right, so this is the last of the test conditions for social factors. This is the tangible condition. And so the tangible condition is usually only conducted if you really hypothesize that there's something that they engage in problem behavior for, because you have to identify an item. So a lot of times iPads, very common reason, it's like the iPad generation. Everybody grows up with their iPad and they really like it, and then maybe they have to start going to school, and the parents are like, I'm going to take your iPad away, and they engage in all this problem behavior to get their iPad back. For our adult clients, we also do see that they engage in problem behavior for iPads, sometimes their cell phone, sometimes food. A lot of times food, actually being denied access to food. And so you have to have an item in mind, though. You can't just pick an item. So if you don't think that they engage in problem behavior to gain a specific item, you can keep this condition out. You don't have to include it. So if you are going to include this condition, so for Bruce, we're seeing if he engages in problem behavior to access his iPad, I believe. And so usually we'll provide pre-session access, meaning we'll go into the room and we'll give them their iPad for a little bit. And then when session starts, we say, okay, we can't have this anymore. So that's what the pre-session access is. We go into the room, they have the item, and then we take it away. That last bullet point there does mention that sometimes that's not the best to do, because sometimes taking it away might be a little bit difficult, like they might really like hold on to it, and we don't ever want to engage in a power struggle with the patient, so if that seems to be a concern, then we just don't do pre-session access. We'll just hold it in our arms, we'll start the session and say, I have your iPad, but you can't have it right now. So the materials, the 2 chairs and the table, and something that's really highly preferred that you hypothesize they engage in problem behavior to gain access to. Stimulus condition, I have your iPad, but you can't have it right now. And this would be for whatever you're running this condition for. I had a patient who engaged in severe head banging for jelly beans. So we would say, I have these jelly beans, but we can't have any right now. So it could be any tangible item. It doesn't have to just be an iPad, although it's very popular. Consequences for the target behavior, if they do engage in problem behavior, they can have their iPad. Right? So for all of these conditions, the setting condition is what's potentially aversive. So the attention, I'm busy. Demand, we're doing work. Tangible, I have this, but you can't have it. Contingent on problem behavior, they get whatever the hypothesized reinforcer is, which is either attention, escape, and now the tangible item. If they engage in any other behavior, like dropping, we would ignore that. And we would keep track of if pre-session access is necessary. Also, if they engage in appropriate communication for it. If you start the session, I have your iPad, you can't have it right now. Why not? Can I have my iPad? Well, it's pretty appropriate. So then we would want to modify our session. And here's an example of a tangible condition.
All right, Bruce. We're done with the iPad right now. You can't have it.
So that was with pre-session access. And pre-session access for Bruce was pretty easy because he's not holding it. We don't have to, take it away. So usually 30 seconds of access is what's provided, just like in the demand condition, it's 30 seconds of a break. In this condition, it's 30 seconds of access. So Tori was keeping track on her watch. In actuality, we have the data collectors keeping track of time, and they give a knock to the session therapist when the time's up. Sometimes the patients pick up on the knock, and then we have to maybe switch our code to And so we're not seeing a lot of problem behavior here, right? Pretty boring. So Bruce probably does not engage in problem behavior taking access to his iPad. The problem behavior that we did see was self-injury, which remember, we're already hypothesizing he engages in for automatic reinforcement. So not uncommon if you see automatic reinforcement for it to pop up in other conditions as well. I think the rest of this video he doesn't engage in problem behavior, so skip ahead. Okay, so we finished all of the test conditions, but remember in any experiment we have to have test and we have to have a control. So the toy play is our control condition. So in all of those test conditions, we had some aversive setup. We had the stimulus condition. It was low attention, it was escape from demands, or if it was, I have your iPad and you can't have it. They engage in problem behavior, they get what they want. That's what we're testing. So in the control, they have what they wanted already. So the hypothesized reinforcer, they're supposed to already have. Because in theory, if they're engaging in problem behavior for that item, when they have it, they shouldn't be engaging in problem behavior. And so that's what the toy play is. It controls all of those conditions. Attention is provided throughout the session, so they shouldn't be engaging in problem behavior for attention. There's no demands. It's toy play. We're just having a fun time. So they should not be engaging in problem behavior if it's escape maintained. And they have toys. They have tangible items. So they shouldn't be engaging in problem behavior for tangible items too. So to make a conclusion about problem behavior, you have to see high rates in the test and low in the control. If you see high rates in both, you can't make conclusions about social reinforcers. That does happen sometimes, that you see high rates in all conditions, and that suggests automatic reinforcement as well. It's just happening all the time. So the toy play, the materials, we have two chairs, a table, we have preferred toys. So for Bruce, we identify his iPod, a Switch, and Uno cards. I think in the video we're not using a Switch because we don't actually have one. So I think we were doing a puzzle, maybe, or the sticker book. Instructions to the patient. So we walk in, we say we're going to play and play with some toys and hang out for a while. Stimulus conditions, so the toys are available, attention's available, so the therapist, we try to sit oriented towards the patient so that they know that we're available to hang out with them. If they don't engage in conversation, we might do more parallel play, so if there's like coloring is the activity, I might be coloring too, and we can color next to them. If problem behavior does happen, it's ignored. So are other behaviors. If any non-problem behavior happens, so for example, communication, if they try to engage us in a conversation, we're gonna have a conversation with them. If they don't engage in conversation, we're still gonna provide attention at least every 30 seconds, and it would just be like, I'm having such a fun time hanging out with you. This is the best day ever. I love your shirt. So just something every 30 seconds so that that attention is being provided. Here is an example of a toy play.
All right, Bruce, we're gonna hang out for a little bit. I have this cool sticker book. I have a puzzle. What we can do together.
Let's look at the sticker book.
All right. What do you think you want to do first?
Let's put some stickers on.
All right.
Ooh, I'm gonna take this little green guy.
Oh, that sounds fun. I think I'll get one to match you.
Oh, cool. Where should we put it?
You put it right here.
Oh, cool.
All right. You want to add any other ones to that?
Yeah. How about this guy?
Pretty cool. Nice.
This is pretty cool.
You want to try the puzzle? Pretty good, this puzzle.
Yeah. It's got like 4 eyes.
It's pretty cool. See anything else on this puzzle? I see one little ant.
It's like a little ant. I think it's a spider. That doesn't go there.
What do you think?
So we're not seeing problem behavior, right? That's good. We don't want to see problem behavior in the
I like the
control
way
if we
you're
want to
doing
make
this
any
puzzle.
kind of conclusions. Tori's providing attention throughout. The tangibles are available. She's not providing any demands.
Oh, nice.
You have to make sure, be careful in the toy play that none of your, you're not providing instructions in the play. Like put that puzzle piece here, because that could be a demand. You want to make sure that you're not doing that. You can
Again, seeing some of
suggest,
the legs pop up.
you can say, oh, I think this puzzle piece might go over here. And that's fine. Just don't push it if they don't put the puzzle piece there. Oh, you don't want to do it? That's fine.
Like how you're trying.
Nope.
Well, what do you think?
Oh.
Let's go there. Can I do one with you?
Sure.
Cool. this piece goes.
Oh, I think it goes here.
Do you want to do the last piece?
Sure.
See, she asked. She's not telling him to do anything.
Pretty
So we
cool
don't want
puzzle.
anything to look like a demand.
See blue spider, and some little flowers.
Awesome. Let's look at the stickers again.
So whatever Bruce wants to do, we're gonna do in the toy play condition.
Pig
I'm gonna
there.
take this guy.
Oh, the guy in the motorcycle. That's pretty cool. Never seen a motorcycle like that.
Okay. So those are the 5 conditions of the standard or traditional functional analysis. There are a lot of modifications that you can make, and I'll talk a little bit about those. But first, I want to talk a little bit about Bruce's results, and then we'll break to practice. So these are how we graph our results for our functional analyses. And so we have, this is a graph of his combined target behaviors. So self-injury, aggression, and disruption, all combined into one. And we've converted this into, RPM stands for responses per minute. So these sessions were 3 minutes long, but everything's converted to a responses per minute. And so this axis is scaled 0 to 10 responses per minute. And each session goes along here. So we consider one session of each kind, 5 sessions, to be a series. So one series is each of one condition. And we usually do at least, I would say, probably 5 as an average, 5 series, and that's what we did with Bruce here. I'd say 3 is the bare minimum, because it's hard to see a trend with anything less. And so we have the different conditions noted by the different markers. So the toy play, which is our control condition, is indicated by these circles. The attention condition is indicated by these blue squares. The demand condition is indicated by these green triangles. The alone indicated by these purple circles. And the tangible indicated by these yellow squares. So we see pretty high rates of problem behavior in the ignore condition and in the demand condition. And we see very low rates in everything else, including the control condition. So we can make some conclusions, but I want to be more specific about my conclusions. So here is a graph of just self-injury. Notice it looks very different when we separate out the different topographies. Self-injury, we saw very high rates in the ignore condition, low rates in everything else. So this tells us that Bruce engages in problem behavior for automatic reinforcement, and the problem behavior specifically being self-injury. Okay. Aggression. So now this is a graph of aggressive behavior, and we see low rates in the control condition, which is great. We need to see that to make any conclusions. And we do see differentiated higher rates of problem behavior in the demand condition, which tells us that Bruce engages in aggressive behavior to escape demands. And here's a graph of disruptive behavior. We see low rates in the control condition and high rates in the relevant test condition, that one being the demand, which means that we can conclude that Bruce engages in disruptive behavior to also escape demands. So SIB is reinforced by automatic reinforcement, aggressive behavior reinforced by escape from demands, and disruption reinforced by also escape from demands. This is crucial to coming up with any effective intervention, because you cannot make a treatment plan without knowing why the problem behavior happens. And now we know why in an experiment with a test and control condition. So we have a really good chance of effectively treating Bruce's problem behavior now that we have these conclusions. So who wants to practice? So for the practice, Urine is going to hand out some of our materials. So she has demand materials. For the things like writing your name, she's going to give you, it's like a laminated piece of paper, so you can use a dry erase marker and do those programs. She also has paper and envelopes, so you can practice those demands that Bruce has. She also has a packet of pretend toys, so we're going to have to use our imagination today. So for the iPad in the tangible condition, there's a fake iPad. And for the toy play, you can use some of these other toys that we have in here. There's a soccer ball, basketball, music, there's a switch, Uno, puzzle, and a coloring book. So you can pick what you want to do for the toy play. So I think what we'll do, usually when we do this training, I'll walk around and ask if people have questions, but just so the translator can hear us, we'll do one condition at a time. And then if you have questions, you'll raise your hand and then I can answer it here in this microphone so the translator can help us out. So once they pass out all the materials, let's start with the alone or ignore condition. So once you get all of your materials, you guys can break up into groups. So one person will volunteer in each group, and you guys can rotate. One person will volunteer to be Bruce, and you can use the same problem behaviors Bruce has. If you're in the group and you're not Bruce or a therapist, you can practice taking data if you want to. On one of the pieces of paper that they're handing out, you can tally how many problem behaviors are happening. If you want to, and then you guys can take turns. Who's being Bruce, who's being the therapist, and who's taking data. And if you have any questions as you go, raise your hand. And as soon as you get your stuff, you can start with the alone or ignore condition. And we'll do that for a few minutes and then move on to the attention. Hello, everyone. I heard that there were questions about the materials. You don't need them right now. For the alone ignore condition, you don't need the materials. You'll need them in a little bit, though. Okay, does anybody have any questions about the alone or ignore? We feel good? Okay, if you guys are ready, then we're going to move to the attention condition. I can demonstrate if you want to. You want to come up? Okay, so remember, in the attention condition, you're going to start by telling them that you're busy. And then if they engage in problem behavior, you're going to provide attention. So you'll be my Bruce. So I'm going to tell Bruce, I'm busy right now, I can't hang out. And so I'm going to act busy on my phone, let's say, because I don't have a book in front of me. And if Bruce engages in problem behavior, that's so awful, Bruce. Don't do that. Okay? And then for data, I'm going to tally that she engaged in one instance of self-injury, because that was her attempt to self-bite. All right? So now you guys practice the attention condition. We'll do that for a few minutes. A few minutes, and then we'll move to the demand condition. Cool? Yeah. All right. Go ahead. Good job, Bruce. Okay, hi, everyone. There was a very good question in the back that I wanted to answer. So somebody asked if you have to run these conditions in a specific order, and the answer is yes. We recommend that you do them in a specific order because each condition sets up a setting event for the next one. So the first one you run is the alone or ignore. So they've now been in a session where nobody's providing attention. Makes attention very motivating. So you run the attention condition next. And so in the attention condition, they're potentially getting attention for problem behavior, so we run the toy play next. So we have a fun time, they have all this attention, they're not doing any work, which is good motivation to then run the demand condition. So you're going to introduce demands after we just had fun, so it's more motivating to engage in problem behavior in that condition, and then the tangible comes next. So that's why they are run in a specific order, because each one is a good motivating operation for the next. So good question. And if you haven't already, move on to the demand condition, and then you can move on to the toy play, because I'm walking around answering questions, so you can just keep going through all the conditions if you want to. You don't need to wait for me to tell you to go on to the next one. Okay, I'm going to go over the last part of this one, because I didn't realize the time, and we only have a few minutes. But we do have, I think after the next one, a Q&A, and so I can answer any other questions then. Okay, so does this work for everybody? The answer is, I wish it did. It would be a lot easier to do our job if it worked for everybody, but it does not. So what happens when it doesn't work for everybody? So there's a lot of different things that you can do. So if we have a patient who comes to us, we start doing the functional analysis, and we're not seeing any problem behavior. What we might do then is maybe invite, somebody had a good question over in the back or middle over there too. We could have caregivers come in and be the therapists because like I mentioned earlier, they don't know us, they might not engage in problem behavior because they don't have a reinforcement history with us. We might invite their caregivers or their regular service providers to get better information there. There could be other reasons why they're engaging in problem behavior. So as an example of an idiosyncratic function, with one patient, we ran the traditional functional analysis, and we saw the highest rates of problem behavior in the toy play, and no problem behavior in the attention condition, which is interesting. If somebody engaged in problem behavior before attention, you'd see high rates in the attention, low in the control, right? But we saw the exact opposite. Which means we cannot make any conclusions that they engage in problem behavior before attention, but something's clearly happening. There's a pattern of responding. And so if you think about when you're doing the functional analysis, you're setting up, in the control condition, you're giving them what they want the whole time, right? And so in the attention condition, you start out by saying, I'm busy, and you're reading your book the whole time and it's quiet. In the toy play, you start out and you say, we're gonna hang out and I'm gonna talk to you and I'm gonna have fun. So for this patient, we hypothesized that she engaged in problem behavior to get out of social contexts. She did not like talking to people. And so we essentially switched those contexts. And so that's what I'm going to talk about here, is how to identify idiosyncratic functions, which just is the fancy word for saying some other different reason that's not covered in the traditional functional analysis. So to do this, you have to really know the science of behavior analysis. So typically, these are done, we usually have to do this in our clinic. Usually, if it's not easy to identify why they're engaging in the problem behavior, you really need a qualified clinician who knows how to create an experiment, come up with a hypothesis, design the test and control condition, and then run the analysis. In the case that I just mentioned, we hypothesized that, we'll give her a fake name, Lizzie, that Lizzie engages in problem behavior to get out of social contexts. Okay, that's the hypothesis. So when we design our experiment, it's very similar to the methodologies that we just covered. So we need to have a test condition and a control condition. In the test condition, your setting situation is what's potentially aversive. And so what's aversive to Lizzie? Social context. So we're going to start the session by saying, hey, Lizzie, I'm going to hang out and I'm going to talk to you for a while. And then if she engages in problem behavior, she gets the hypothesized reinforcer, which is for me to shush. So, hey, Lizzie, I'm going to hang out. We're going to talk a while. She engages in problem behavior. And I give her 30 seconds of no speaking. In the control condition, you're supposed to give them what you hypothesized they wanted all along, which is complete silence, and for me to not bother Lizzie. So in the control condition, we just sit in silence for the whole time. So if she engages in problem behavior, for me to not talk to her, in the control condition, she shouldn't be engaging in problem behavior. So you can do that for any hypothesized function that there is. So I'm going to take you through another example of one of our patients. We'll call her Jessica. So Jessica, her parents told us that she engages in problem behavior to get items, which sounds like tangible, correct? And so a lot of you guys asked when I was walking around, what happens if they are asking for attention? What happens if they are asking for tangible items appropriately? On the session description, it says talk to your BCBA. It says talk to your BCBA because you probably have to do something like this. You have to design something different to identify an idiosyncratic function to see, okay, well maybe they engage in problem behavior when they're denied access to something, when they're told no, or that they have to wait for something. So it's not specifically for an iPad. It's when you say, no, you can't have the iPad, or you have to wait for the iPad. So for Jessica, her parents told us that she engages in problem behavior when she's told no for anything. They don't say the word no because it's a trigger word for her. And so she came to our clinic. We actually did run a tangible condition. We ran a traditional functional analysis, and we didn't see anything in the tangible condition. She didn't engage in any problem behavior, and she very appropriately asks. She has a lot of language skills, and she would say, can I have grapes? Can I have celery? Can I listen to Blue's Clues? Can I listen to Michael Jackson? So very good. All these things she loved. So she'd ask for those and we would give her those. So then we decided to test, okay, well, does Jessica engage in problem behavior when she's denied access, to gain access to something that she was denied? So when you're setting this up, so we have our hypothesis. To design, you set it up, the stimulus condition is she's in what is potentially aversive, being told no. So the session started with, she would say, can I have some grapes? We would say, no, you could have celery instead. And if she engaged in problem behavior, okay, fine, you can have grapes. So if she engages in problem behavior, we give her what she's potentially engaging in problem behavior for. She says, can I watch Blue's Clues? We would say, no, but we could watch Arthur right now. Engages in problem behavior, okay, we could watch Blue's Clues. And in the controlled condition, they're given access to the potential reinforcer the entire session, which is just saying yes, 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 yes to everything she asked for. Can I watch Blue's Clues? Yes. Can I have grapes? Of course. Can I listen to Michael Jackson? For sure. So you would just say yes to everything she wanted. And actually, I do have her data. Oh, I had an animation that I didn't use, but that's okay. So to be a little bit confusing, there's a different way that you can track how often problem behaviors happened. Counting how many problem behaviors happened is one way you can do it. You can also keep track of how fast they are to engage in the problem behavior, and that's called latency. So the latency to the first instance of problem behavior, and that's what we did with Jessica. It's very helpful, especially when they engage in very severe problem behaviors or problem behaviors that really disrupt the environment. So for example, elopement, running away. If they bolt out of the room, a lot of times you'll just set up the condition. And the way that you keep track of this is you would give that statement, let's say we're running the attention condition. Hey, I'm gonna be busy right now. I can't hang out and I'm busy. The data collectors start a timer. And then contingent on the first instance of running away of elopement, the data collectors stop the timer. Maybe it took 15 seconds for them to engage in problem behavior. As opposed to the control, maybe they went the whole 5-minute session, didn't engage in any problem behavior, we would note 300 seconds. And so that's what we did with Jessica. She engaged in very severe aggressive behavior specifically. So we kept track of the latency to the first instance of problem behavior with her. And so sessions were 5 minutes, so it went from 0 to 300 seconds. The test condition is indicated by these red squares. And so she was very quick to engage in the problem behavior. In the test condition, when we told her no, and she was given access to the item contingent on problem behavior. And we didn't see any problem behavior in the control condition. And so we very quickly made the conclusion that she engages in problem behavior to gain access to items previously denied. And we were able to treat that accordingly. So you can do this for any hypothesized function. So if you do your traditional functional analysis and it doesn't work out, you can come up with a different methodology to identify idiosyncratic functions. And I'm a little bit over on time, so we'll save our Q&A for after the second part. I'll let you guys take your break now. Thank you.